Sleeve gastrectomy is now a very common bariatric operation, and the reason it's common is it's quite predictable and it's relatively straightforward for the vast majority of patients to head down the pathway of sleeve gastrectomy. If you're battling your weight, if you're challenged with diabetes, hypertension, sleep apnea, joint problems, fertility issues, this is an operation that generally will give good relief from those symptoms. And most people who are diabetic are probably going to be in remission from their diabetes afterwards. People with joint problems will have much less joint loading. People with sleep apnea may well get rid of their sleep apnea afterwards. And the same for hypertension. And it's a procedure that it's keyhole. It requires a 3-day hospital stay, a pretty rapid recovery. Most people are within 2 weeks back at work. And that's what patients like about it. They like it because they have generally good quality eating. After about 8 weeks, they're eating normally. And they lose weight in a very predictable fashion. Most people will lose about 80% of their excess weight over a year. And those are all the good things about it, and that's what people like. The risks of the surgery that people need to be aware of is there's a small risk, probably about 1%, possibly less, of having a leak from this stomach that we're creating, and that is actually a big deal and could require a prolonged period of hospitalization. There's also a risk of weight regain that we sometimes see as the years go by, but certainly in the first 5 years there's usually very good weight control. People also worry about, will there be some dietary deficiencies after this operation, but that seems very unlikely. So in summary, it's a very solid procedure for weight loss with good resolution of comorbidities, with a very good safety profile.